Welcome to Medico Important Simplified. So, now we are going to look at a very important topic, a very important question in orthopedics also, which is torticollis. Torticollis. So, first, what is torticollis? Torticollis often refers to as twisted neck. Okay, it is a twisting of neck, and it is often a symptom of cervical spine injury. Okay, it is often a symptom of cervical spine injury. So generally this torticollis can be either it can be congenital or it can be secondary. Okay, so where the congenital or the infant muscular torticollis is one of the most common type of torticollis. Okay, this one is the most common type of torticollis. So if you look at this congenital or infant muscular torticollis, this is otherwise referred to as wry neck. This is also known as wry neck. So if you look at this, there is a typical appearance in congenital or infant muscular torticollis. So I'll draw you a figure. So if this is the head of the baby, say suppose this is the head, this is the ears, and this is the neck. This is the shoulder. Okay, so yeah. So if you look at this, in one side, the sternocleidomastoid muscle, there is going to be contracture. So there is going to be a contracted sternocleidomastoid muscle on the one side, whereas the head is going to be tilted. The head is tilted towards the affected side. The head is tilted towards the affected side, and the chin is going to be pointing away from the contracted muscle. Okay, so this is the characteristic appearance, and this characteristic appearance is known as the cock robin appearance. So this is the typical cock robin appearance, where the head is going to be tilted towards the affected muscle. There is going to be a contracted sternocleidomastoid muscle, and the chin is going to be pointing away from the contracted muscle. So if you look at this, the cause for generally in congenital or infant torticollis, what is going to occur is there is going to be fibrosis of sternocleidomastoid muscle on one side. So there is going to be fibrosis of sternocleidomastoid muscle on one side, and therefore that side will also elongate. That side will fail to elongate as the child grows. So, and this side sternocleidomastoid muscle will fail to elongate as the child grows. So it is due to the fibrosis of sternocleidomastoid muscle on one side that fails to elongate as the child grows. Now the cause is muscle ischemia from the distorted position in utero or any birth injury. So what is the main etiology? What is the main etiological cause? The main etiological cause is there is going to be muscle ischemia. Because of this muscle ischemia, why there is muscle ischemia? Due to any distorted position in utero, say breech position in utero, or any kind of birth injury. So there is going to be, because of these things, there will be muscle ischemia. So generally the mother will give a history of labor, a difficult labor, followed by a lump over sternocleidomastoid. So there is going to be a history of difficult labor or a lump in the sternocleidomastoid muscle. So this is a typical history they will be giving. So it's otherwise just lump in sternocleidomastoid muscle is otherwise known as sternocleidomastoid tumor. This tumor generally appears in the first few weeks of life, which disappears in few months, and then few months it's going to be present. Then there is neither deformity nor any obvious limitation of movements, and generally this deformity does not become apparent until the child is around, say, this child is around 1 to 2 years. So it is again the etiology, it is associated with breech delivery, shoulder dystocia, birth injury, and sternocleidomastoid ischemia or tumor. So this congenital torticollis is associated with breech delivery, shoulder dystocia, and any birth injury or sternocleidomastoid ischemia or tumor. Okay, as I already discussed, sternocleidomastoid ischemia or tumor. So the head will be tilted towards the involved sternocleidomastoid muscle, as you can see here. The head is tilted towards the affected side, and the chin is rotated towards the contralateral shoulder, therefore producing the cock-robin appearance. If you look at the sternocleidomastoid muscle involved in this side, so this sternocleidomastoid muscle that is involving the affected side may feel tight and hard, and a mass or a knot-like feel. So this is how this affected sternocleidomastoid muscle will feel like: very tight, hard, and a mass or a knot-like structure is detected in the body of sternocleidomastoid. So it can disappear spontaneously, and there may be also asymmetrical development of face leading to plagiocephaly. Plagiocephaly is nothing but flat spot on the head. So how are you going to treat torticollis? So what is the treatment of torticollis? So the treatment is a unipolar release or a bipolar release. So what do you mean by this release, unipolar or bipolar? So unipolar release is involving only one sternocleidomastoid muscle, whereas the bipolar release involves two sternocleidomastoid muscle heads. So both the head involving is bipolar release. Only one head of sternocleidomastoid involving is a unipolar release. And when do you generally do this? Optimum age is 1 to 4 years. Okay, so this is all about torticollis. Now let's solve few questions regarding this topic. So let's solve this question. All of the following are true in infantile torticollis except option A, it arises from birth; option B, facial asymmetry; option C, commonest form of wry neck; option D, infarction of sternocleidomastoid. So if you look, there will be facial asymmetry, plagiocephaly, that is true. It is a most common form of wry neck, that is also true. Infarction of sternocleidomastoid or a sternocleidomastoid tumor will be there, that's also true. But it arises from birth, no. It usually, this deformity will be apparent only during 1 to 2 years of life. Okay, and generally there is only going to be a very difficult labor history followed by just a sternocleidomastoid tumor which can resolve spontaneously. Only that history will be given. So it's not always that it arises from birth. It's generally seen after birth also. So the answer will be first option. So if any So if you want to stay tuned and to know more questions, stay tuned to this channel, click the bell icon and subscribe. Thank you.